Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we are here with all our Medicircle audience with yet another interesting healthcare startup founder. So, his name is Kartik Vijaywargi. Kartik is the founder and the managing director of HArbor Vision Private Limited. Now, what does Harbor Vision do? So, it tends to be the global platform for integrating healthcare solutions by leveraging advanced technologies in their simplest forms to create sustainable and standard healthcare operations across different facilities. So, let's know from Karthik more about their startup. Hi, Karthik. Welcome to MediCircle.
Hello, Smita. Thanks for having me.
So, as the founder and managing director of Harbor, tell us more about Harbor and what problem area is it trying to solve?
Essentially, you've covered the mission statement for Harbor, but I'll still simplify it for the audiences. So, Harbor is essentially a retail healthcare platform which is focused on bridging the gap between private healthcare and public healthcare. How are we doing it? First, solving it for the doctors operating in private healthcare space, essentially in retail sector, wherein we are connecting the doctors with their chosen radiologists, pathologists, their medical staff, their administrative staff, with their patients on a single platform, without being a listing business, right? And in the
That
longer
must
run,
be the USP, Karthik, because there are so many listing
yeah,
website startups which are there. So that's one very big differentiator.
yeah. Yes, so that's why I emphasize that without being on a listing platform. And in the public healthcare space, we are trying to take healthcare and care delivery to the doorsteps of our rural India or Bharat, as they call it, at a much affordable, accessible format. I mean, it pains me to see that for basic healthcare, the average distance traveled by the citizen of India is about 90-95 kilometers, right? Why should they have to travel that long for healthcare? And essentially, when the transition needs to happen from public to private, the mechanism is missing. So that is why Harbor was, founded with the vision to have two different verticals who are working independently, but have an interconnected bridge for patient's journey. Having said that, we want to solve it for the doctors because we are anyway short of medicos in this country, right? We're a country of more than 130 crore people, and you can never have enough doctors.
Yes,
So
in
our focus has
2022,
always,
sorry to interrupt you. I would just share a fact here. In 2022,
yeah,
this patient doctor ratio, which is definitely not as per WHO, it was 1 is to 834. That means for every
yeah,
824 patients, we had one doctor, which is very, very absent.
one doctor.
Yes.
Exactly. So you unless you solve it for the doctors and bring them to the epicenter of healthcare actions, you remove the pressure of administrative tasks. You remove the pressure of performing better than their competitors. You cannot fix the way healthcare is delivered in the country. So this is essentially why Harbor has two different verticals of private and public, and this is what we are doing on a much larger scale.
So basically, Harbor is trying to solve problems for the healthcare professionals out there to make their practices
Yes.
easy so that more and more patients can be consulted, as we don't have so
Consultant.
many doctors in India to treat, especially the rural
Exactly.
population in India. So apart from that,
Exactly.
what are the prime USPs of your startup so that
Yeah.
we can uh, we can know more about it, as there are so many startups and trying to solve a different problem. Today, automation
Yeah.
is very difficult as far as doctors are concerned, but our technology is actually going to solve this problem. So, how far technology is being used into this, and what are the prime USPs?
Yes. I mean, thank you for asking such a brilliant question because as I iterated earlier as well, we are essentially focused for solving it for the doctors. See, the biggest problem with tech adoption in India has been doctors find it very difficult to adopt a technology solution. You can have a template driven system on the right hand side, and you can give them a smart pen, but a doctor still, there's a huge learning curve which it comes with it. Essentially, in our previous experiences with different organizations, we realize doctors find it very easy to speak what they want to do with the patient. So we developed an AI wherein a doctor can still click on a mic button and speak the entire EMR. So what essentially happens is we've trained this AI on medical data for Indian accent. So what it essentially does is the tech adoption for the doctors increases, right? And you're still able to create an incidental EMR. On top of it, we realize that any doctor who is working into a private healthcare space still needs to make a commercial sense out of their business, right? So how do you do that? Is to take these mundane administrative business KPIs away from the doctors and create a system which is independent of doctors, so that the doctors can start trusting their receptionist or administrative staff for running the business for him, because he knows there's a system in place for those SOPs.
Definitely.
When you look at the rural population, right? When you talk about telemedicine, it was a fixed module for during COVID eras. But when you look at telemedicine as a service, it is still solving problems for the urban population, right? The penetration of telemedicine in rural India, Bharat, is very low, because these people do not still understand technology to the much larger extent. We wanted to bridge that gap with our assisted telemedicine health kiosks. Also, from the doctor's perspective, when you talk about the USPs, right? From the doctor's perspective, how do I give my patients, if I'm sitting in a city, let's say Bombay or Nagpur for that matter, how do I give my patients that experience that even during COVID, or let's say it's a rainy season going on, they don't have to come to my clinic for a follow-up visit. So we changed the way telemedicine was perceived. Now, our doctors are giving telemedicine as a service to their patients for something as simple as a follow-up visit. And for rural India, the patients have an assistant paramedical staff which HArbor is deploying for connecting to the doctors. It increases it increases the care quality on telemedicine as well, because now my doctors are able to have a medical input from a trained paramedic. How is a gastroenterologist in a position to feel the tenderness of a patient in his abdomen on a video call unless the input is coming from a trained paramedic? So we wanted to fix these issues. So these are the few. So I gave you a couple of examples, but we have built our system thinking of solving the problem on ground zero. Largely, one of the biggest USPs that HArbor has with its medical providers is our business model is not built on selling patients' data. We respect the patient's right to privacy. We understand that this patient's data which is owned by the doctors. So we take our patient's data privacy to a large extent. We don't want to be selling patients' data to large corporations for their profits, right? We want to build an ecosystem of healthcare services wherein everything is done in a single, platform. And that is also reason why we diversified a couple of years ago. And apart from our software platform, we launched our own rapid test kits. We launched our own diagnostic machines. Now we are FDA CE certified, because we wanted to have these battery operated rapid test kits or battery operated machines into rural healthcare, wherein the paramedic is in a position to tell the doctor, sir, I have done the dengue and chikungunya tests on the right, on the outset, on the point of care, and your clinical suspicion is going towards dengue or chikungunya or malaria. So we wanted to create this, plethora of services under the single platform, and that has become our single largest USP, that we are a one-stop solution for everybody.
How many HCPs you have connected so far who are using your services?
Yeah, so we have recently launched our platform into the private healthcare segment. We have last around 3 to 4 months of soft launch that we have had. We have more than 150 doctors who are using it on the private healthcare segment. And talking about the public health, we'll be completing our rollout in around 3-4 districts in the next couple of months, which is impacting approximately 10 lakh plus patient lives. And we have done all this very recently.
Oh, that's
So
great.
yeah,
So
that's the adaptation we have had.
that's great. So tell us something about your revenues. So what were your revenues in FY 2022 and what you're planning to close at this end of the year FY 2022?
So 2022 came as a good year for us after overcoming the initial startup struggles. We are now, I think, in a position where we are ready to explode in all verticals. This year, we are launching in 5 more cities. We are essentially operating out of Nagpur and Ahmedabad right now. We
That's
are launching by the end of FY 2023. We are launching in another 5 cities and completing around 8 to 7 more districts for our public healthcare platform. So this is where our 2023 is looking very promising, and Harbor will start creating impacts for the longer run this year.
that's great. But it's don't you feel it's an irony that 75% of the Indian generation, I mean the Indian population is there in the villages, and 75% of
Yeah.
the doctors are based out in metro cities or cities which are very very far from the rural population. So we can definitely
Yes.
see there's a huge gap, and I think startups like Harbor, they are definitely trying to overcome the challenges which are there in the rural populations. So tell us more about the different challenges that especially startups face during the initial phases, and how easy it is to scale it up, especially something where we don't have that kind of tech adoption also. uh,
Yeah.
to a certain extent, because I think 40% there as per the database data stats, there are a lot of rural population who are using the smartphones. But if you talk about healthcare literacy, 9 out of 10 Indian are healthcare illiterate. So they are
Yeah.
accessing smartphones, but it is not solving their health problems. So how do you see this, and
Yeah.
what are your vision to solve this problem?
Yes. Yeah. See, I mean, speaking on the first part of your question, Smita, wherein how do we increase the literacy? I'll lead by example, right? When we were doing the first ever pilot, it was sort of a hilly region, and it was peak summers last year, wherein getting the patient to your health kiosk and telling them this is something for your betterment, for your healthcare need, was the most challenging problem that we had. I'll give you a stat on this. We were doing a pilot on a district which has roughly 2.5 lakh people residing in the nearby areas. And last year, I mean, before our pilot, they had 27,000 snake bites in a span of 2 months. And the first line of treatment that these people take is to take the patient to a temple and pray to the god, right? Because they don't trust a system. So our biggest challenge was understanding the needs, having local resources, having sarpanches, having a little political will on the ground to tell the people that this is for you, right? Was the biggest challenge we faced in our rural implementation. I mean, that sort of thing we also faced. It's something when you look at the private healthcare, you're facing a similar problem with doctors telling them to adopt the system. So we started running IEC and BCC activities on the ground. We had NGOs running and telling the patients that this is something you should do, this is something good. And that's how we started scaling, right? And there's a lot of hard work that people at Harbor put in on ground. There's a lot of footwork. And that's how we were able to, crack those initial first traction wherein we could get that significance going.
That's
Uh, we had similar problems in private healthcare, wherein uh, tech adoption with doctors was very tough. So we created a team of people who were relationship managers for the doctors, who would sit beside the doctor inside the OPD and teach them how the system needs to be done. And that's how my EMR adoption has gone upwards of 80-85%.
So I think you have
So
closely worked with how, because see, once you design a system, that's another thing. Getting it
yeah,
implemented is completely different thing. Execution
completely
will be
different.
out there. I think through your different methodologies and your good team, I think it definitely helped you out
Health.
and to
Yeah.
scale it up because it's really difficult when you come to rural health problems in India. So, any
Yes.
piece of advice or any learning which you would like to share with our audience today while watching this healthcare startup video?
See, I'll start with the piece of advice with my mentor used to always tell me. He came essentially from business background. He said, Kartik, people will always tell you to to do this and that. You always reason with them. You always go to them with logic. But inside, if you have conviction to do what you think, you should build everything on day one, and start of thinking, start to create an impact from ground zero on day zero. And that's a piece of advice I always tell people. Don't plan your resources according to MVPs. I'll create an MVP, then I'll raise up angel round, and I'll then go on building. Don't do that. Have conviction in your thought process. Build everything that you can on day one, and eventually grow from there.
That's very cool piece of advice from Kartik Vijaywargi. So thank you so much, Kartik, for joining us today at Medicircle Healthcare Startup Series. We wish you all the best, and also startups like Harbor Vision, who are especially working in the rural population of India, where they are really in a need to have this healthcare access, availability, and also bring down the cost so that it becomes really important, affordable for them. Because they also are going through the same problems, but definitely they don't have an access to the healthcare system out there. So I wish you all the
Yeah.
best, and it was really great talking to you. Thank you.
Thank you so much, Smita. It was a pleasure to connect with your audiences, and thank you so much for having me.